All right, so good morning, I'm Nicholas. I'm going to be conducting our assessment interview today. So I'm just going to be reading off like script. This is just the standard questions that our clinic really requires when we're doing assessments. So
Okay.
could I get your full name?
Mary Bria.
Okay. And what's your gender or identity?
I'm female.
How old are you?
40.
And what's your marital status?
Single. I was divorced, so
Okay, so
I just hate that
I'll
stigma
just-
of putting a divorce on there.
right. I do have to put it down as divorce, but of
Okay.
course no stigma behind it. Just kind of like our standard procedure.
Okay.
Then what would you describe as your ethnicity?
I'm white.
Then is English your preferred language to communicate in?
Yes.
Okay. So were you self-referred, or did somebody refer you to come see us today?
I referred myself.
Okay. So I'm just going to go over our limits of confidentiality and informed consent, everything that we kind of have to fill out before we actually go deep into the interview. Kind of let you know about the procedure, some risks of this. It's nothing like, life-threatening, but some things may come up that may be uncomfortable, and then just kind of your rights and as a client of ours here. So confidentiality, everything that we say here is confidential. However, we're all mandated reporters as clinicians here, as providers. So disclosing anything to do with abuse, whether it's sexual abuse, whether you're the victim or the perpetrator, abuse of a child or of a vulnerable adult, anything like that. Any forms of, well, not any forms of UCMJ violations, but certain more serious things, any current risk of suicide, homicide, anything like that, any alcohol use, or I mean, not alcohol usage, but substance usage, could be possible for reporting. If you have any more questions on like the specifics, then we can kind of dive deeper into that. But other than that, I think that's about it. As far as risks and benefits, so what we talk about here today, the questions I'm going to ask are going to go a little bit deep. So it's going to go kind of into your past a little bit. So if there's anything that may in your past that may cause an emotional reaction, I'm just letting you know that might happen, but it's kind of important to know for this whole process. And then benefits, of course, we want to see improvement, just overall improvement in mental health, life satisfaction, things like that. And the assessment process is just kind of like I was saying, we're going to go kind of, it's a biopsychosocial assessment, so we're going to go kind of like into your history, like family history, friends, occupation, school, just kind of anything that we can really hit, then we'll go from there.
Okay.
And then kind of dig deep into that. Does that sound good? Are you agreeable with that?
Yes.
Okay. And please just need your signature on some of these forms. Alrighty, perfect. Thank you so much. So we'll start with your primary concern, or what brought you in today. So what would you say brought you into the clinic today?
I'm just not really sleeping well right now.
Okay. So how's your sleep changed since before you were not sleeping well?
I usually slept pretty well, maybe not perfect, but I've just been in a lot of pain lately, so I think it's just been really hard to sleep.
Okay, what kind of pain have you been in?
Back pain. I hurt my back on my last deployment, so it's been kind of interrupting my life in every way, I think.
How long ago was that last deployment?
It was about 4 or 5 months ago now.
before you hurt your back, how many hours were you sleeping in the night?
I'd say about 7 to 8 usually.
And how much is that now?
It's probably around 5. I wake up at least twice in the middle of the night.
Alright, and you said it's been affecting your whole life?
Yeah, I'd say mainly my sleep, but because I'm not getting any sleep, I'm just like really tired and kind of irritable, and so I don't know, I just don't really want to do anything. I don't go out much anymore. I'm just too tired, and I just really kind of, I don't know, lost interest in going out. I don't know, I'm just very uncomfortable with myself. I gained about 25 pounds in the last few months. I don't know, I don't feel like myself.
Okay. I'm going to move on to some questions. They're very standard across the board that pretty much any clinic's going to ask, and we're mandated to ask them here just to ensure your safety, things like that. So, are you currently feeling suicidal at all?
No.
What about homicidal, wanting to hurt or kill somebody?
No.
Are you currently using any substances, alcohol, pain meds, anything of that nature?
I was given pain meds for my back. I'm on hydrocodone, and it doesn't really help my back very much. I'm still in pain, but that's the only thing I'm prescribed for that.
Okay, how often do you take it?
Twice a day.
Other than that, do you use anything else? Alcohol, nicotine?
Not any more than normal, maybe a beer or two a week or something at the most, but I'm not a big drinker.
Okay. Then what about in the past? Have you ever had any thoughts of wanting to die by suicide, or any thoughts of hurting or killing anybody else?
No.
Okay. So you said 4 to 5 months ago you hurt your back.
Mm-hmm.
How did you hurt it, if you don't mind me asking?
We were out in deployment. We were out in the field, and I don't know what happened, but had my rucksack on, and we were walking for a while, and I think I just tripped or something, like I stepped wrong, and it twisted my hip, which then affected my back. So I stepped into in between two rocks kind of thing. And so then I had the heavy pack on as well, and then it just all twisted. So.
That sounds painful. I'm sorry to hear that. Okay. And it's been just constant back pain for 4 to 5 months now?
Pretty much, yeah. It really hasn't subsided. I'm in therapy, but it's barely gotten any better in the last 4 or 5 months. So.
Okay. What would you say is like your usual pain level from 1 to 10, 10 being like the most painful, like daily?
I'm usually sitting around a 6. On my good days, it's a 5, but it's uncomfortable to like sit for too long or anything like that.
You said you're in physical therapy for it?
Yes.
Okay. Have you ever been hospitalized for it?
No, I was just outpatient. You know, when you're deployed, they just give you an ice pack and some meds and say, keep going. You know, so I didn't really get it taken care of with physical therapy until I got back.
Have you ever been hospitalized for anything at all?
No.
And you said that this back pain has made you feel depressed and that you've gained some weight, things like that.
Yeah, I think depressed is the right word. You know, it's most days I just don't feel like doing anything. It's just kind of pointless to do anything because I'm in that much pain and I'm just tired. So I don't really try anymore. I think I tried to when I first got back, but it was just too much pain and nothing's fun right now. I like to do things that are active and I just decided to, I don't know. I didn't feel like calling and then like calling my friends and then making any issues with me being like the Debbie Downer of the group. So I just stopped.
Okay. Yeah, I'm sorry to hear that. Okay. You said that you feel like the Debbie Downer on your friends, things like that.
Yeah.
Have they ever kind of expressed any concern over how you've been since you came back from deployment?
Yeah, I think that they had in the beginning, when I first started, you know, avoiding going out basically, you know, but I feel like in a sense some of them just stopped trying to even ask me anymore to hang out. There's only a couple friends that maybe will come over once in a while and just check on me and whatnot, but yeah, I don't know. Just don't feel like doing anything anymore.
And besides physical therapy and the medication, have you kind of tried anything else to help the back pain or maybe even the depression?
Not really. I like to go hiking and everything and walking, but it's just been very painful, so I can't go for a long periods of time. I've tried stretching and yoga, but my joy is being outside and you know, experiencing the environment and the trees and the mountains, and I just can't do that anymore.
Yeah. So besides the back pain and the depression caused by it, you know, lack of being able to partake in your previous hobbies, what other kind of concerns do you have about it?
Obviously I don't like the amount of weight that I've gained. I don't know if that has to do with the lack of exercise that I'm used to, the pills that I'm taking, or what, or the lack of sleep basically. Maybe all those things. So those are my biggest concerns, but I feel like it's stemming a lot from the pain. You know, I've been on deployments before. I've had some nightmares as well, but I feel like it's part of the pain because I'm up, you know, I keep waking up in the middle of the night. I'm not sure, you know, like I said, I've been on deployments before. I don't know why I would be having nightmares now. So I'm not sure if the pain is contributing or the meds or whatever, but yeah, I'm just in a weird time in my life right now, it feels like. I feel like maybe it's time to retire.
So it sounds like you're going through a lot of big changes. Yeah. So you mentioned, sorry.
Oh, no, you're fine. I was just gonna say just a lot of internal stuff that I've been thinking about because of the pain. I'm like, oh, should I even stay in the military anymore? But, okay.
So, you just mentioned nightmares.
Mhm.
So, do they happen often, or?
It's been like maybe once a week since I got back. About, maybe even less than that, but and they're really not about anything specific. It's just I wake up with almost like a night terror, but I keep wanting to attribute it to my pain because when I move in the middle of the night, I get the shooting pains and, you know, it startles me.
So nothing specific, like, you know, there's nothing like reoccurring about that dream. It's just more of like, you know, feeling the pain, kind of.
I think so, yeah. I can't recall anything that's recurring. It's usually the only theme I can actually think of is me hurting my back again, like me being hiking and then hurting myself, and that's when I wake up. So I think that's just in the back of my mind running around, which is also why I don't want to go out hiking by myself again and then hurt myself again, and it's just this whole cycle of thought that I have with it.
Of course, yeah. So maybe the back injury causes a little bit more of a internal injury too, especially with the loss of being able to do the things that you love to do.
Yeah, that sounds like a good way to wrap it up.
I'm sorry to hear that.
Yeah, thank you.
So I'm gonna go into some deeper questions about kind of your background, your childhood, things like that. So, do you have any sort of form of history, either from childhood or even early adulthood, from victimization, like physical, mental, sexual abuse, anything like that?
No.
What about family or intimate partner violence?
No.
In the military, have you ever experienced any form of discrimination or sexual harassment?
When I was, first started, maybe I felt that way, but, being a young lieutenant, I guess you always kind of go through a little light hazing, but otherwise nothing major.
Okay. How would you describe that light hazing? Was it harassment or sexual harassment? Or kind
No,
of like
I wouldn't say that. I think it was just positionally, just being a second lieutenant, or second lieutenant and first lieutenant actually. Just that lieutenant phase, but otherwise not sexual.
Okay. So it's more of discrimination.
I would call it rankism.
Rankism?
If I had to. Nothing that like stuck with me, but just you just remember
Right.
being that rank. So
Yeah. Being on the lower end of the
lower
totem
end,
pole.
yeah.
Yeah. I remember that too.
Mhm.
And so you said no history of any psychiatric hospitalizations
No.
or any hospitalizations whatsoever.
No.
What about history of outpatient treatment in any sort of clinic?
Just for my back, I had the outpatient stuff when I hurt myself, and but nothing like mental health related, just physical.
Okay. Have you ever been prescribed any psychotropic medications such as antidepressants or anti-anxiety, anything like that?
No.
What about traumatic events in your life? So thinking as far back as you can remember, those can include like losses, loss of a family member, any form of like accidents, just like for example a car accident or anything like that?
Nothing major. I mean, I lost my grandfather when I was younger, but that was just the natural progression of life. At that point, it wasn't something that, stuck with me as abnormal or traumatic.
Okay. How old were you when you lost your grandfather?
I was 12, about 12 or 13, I think.
And would you say that you two were close?
I'd say that we were, I don't know if close was the right way to say it. I was really close to my grandmother more than my grandfather, but he was always around when, we would go over there, so. Mhm.
Okay. Any other forms of like significant events in your childhood or throughout your life that may come up? at any
Not that I
moment?
can think of, yeah, not that I can think. Mm-mm.
Okay. So you said you were divorced. I want to ask about that.
Sure.
So, how long were you married?
About 8 years.
And I also didn't ask, do you have any children at all?
No.
Then, did any significant events happen in that marriage?
No, we just kind of grew apart. We just weren't able to be stationed together, and it was kind of a amicable split, I suppose. We had been friends for a really long time, and then we were just apart for so many years of our marriage at the tail end here that it was just hard to keep going. So we decided to just split.
How long ago did you get divorced?
About 2 years now.
Have you had any relationships since that divorce?
No, I've been kind of busy with the deployments and everything, that it just, a couple dates here and there, but just not enough time to establish anything.
Okay, so I'm going to go into something called a mental status exam.
Okay.
It's a standard procedure that our client does, just a couple of questions to test like awareness, cognitive function, things like that. So,
Okay, thank you for telling me.
of course, how would you describe your mood in one word?
Content.
Okay. Are you currently seeing anything that's not actually there, hearing things?
No, neither.
No? Okay. So I know I asked this before, but no thoughts of killing yourself or anybody else, or harming yourself?
No.
Anybody else? Okay. I'm gonna ask some of those, or actually one more question. Do you ever wish to be dead at all?
No.
I'm gonna ask some of those concentration, kind of cognitive function and questioning, so
Sure.
questions. So can you please state your full name?
Mary Rhea.
And where are you right now?
I'm at a clinic in a session.
And what's today's date?
September 12th.
And do you know the approximate time?
It's got to be about maybe 9:15.
Okay. And what's the purpose of today's meeting?
I came in because I'm just feeling a little bit down because of my pain.
Okay. Then I'm gonna ask you to repeat some numbers after me. 57902.
57902.
Okay. I'm gonna name 3 things that I want you to remember. I'm gonna ask you about them later.
Okay.
Or 3 words actually. So it's car, hat, and computer.
Okay.
Okay. So can you tell me what town or city you lived in when you went to elementary school?
Lamont, Illinois.
Okay. Can you count backwards from 20 by fives?
20, 15, 10, 5, 0.
Okay. Can you repeat those 3 words that I said earlier?
I'm trying to think of them. Hat, car. I forgot the last one.
It was computer. That's alright. 2 of them.
I was looking at a computer too.
2 of them were C's, so that's alright.
Alright.
It's kind of a silly, like, I don't doubt that your memory's good just because you forgot one of those words. It was like, had questions in between, but yeah.
Okay.
Okay. What body of water is on the east coast of the United States?
The Atlantic Ocean.
Okay. And can you name 3 U.S. states?
Illinois, Iowa, Nebraska.
So if you buy an item for if you use $20 to buy an item and the item costs $13, how much in change?
$7.
Okay, good. Then, how are a pencil and a pen alike?
You can write with both of them.
Okay. So, if you were walking on a sidewalk and you found a sealed, stamped, and addressed envelope, what would you do?
I'd put it in the mailbox.
Okay. If you smelled smoke in a movie theater, what would you do?
I would get out and probably tell others to get out.
Okay. So, what are your future plans like for the weekend?
I think I'm gonna go see a movie. And maybe do some journaling. I'm gonna try to get into journaling.
Okay, good. All right. Thank you so much. We'll move on to our next set of questions.
Okay.
Okay, so how do you feel about your current living situation? Do you feel safe at home?
Yeah, I feel safe. It's just me.
Okay. Just you at home, nobody else?
Not since the divorce.
No pets or anything like that? What about your neighborhood surroundings? Would you say you live in a safe area?
Yeah, I think so.
Do you live on post or off post?
Off.
And throughout your time living alone as an adult, have you ever experienced loss of housing through eviction or inability to pay or anything like that? Do you have any firearms in your house?
One.
Okay. And where do you store it?
Oh, I have it in a locked gun case.
Which room of the house is it in, if you don't mind me?
It's in my bedroom in the closet.
Okay. Do you use any community resources, such as community gathering or areas or recreational centers, maybe even food banks, anything like that?
No.
Do you feel that your community needs any resources?
I don't think so.
Okay, so do you have any past or present concerns with your living situation?
No.
So move on to just some history on your family and social support, things like that. So, how would you describe your family while you were growing up? Like parents, brother, sister. How would you describe that dynamic?
I think we're pretty close. We were raised to be independent, so we didn't need to be on each other all the time, but I say pretty supportive family.
Okay. Any concerns about the way that your mom and dad handle parenting or anything like that?
Not really. My mom wasn't around as much, like wasn't home as much as I wanted her to be because she worked a lot, but otherwise I knew, she was just doing what she had to do.
Okay. Who do you consider to be your support system right now? I know you mentioned those couple of friends that still check up on you.
Yeah, I just have a few friends. One from my childhood actually, but she doesn't live near me. And then one close friend from the military. Otherwise, I'm close with my brother, but he still doesn't live really near. My parents are supportive, but again, they don't live anywhere near me.
So besides back pain and depression, things like that, are there any other stressors that you're currently experiencing?
No, not really. I mean, I think just the residual effects of the back pain, just, me gaining weight is very uncomfortable. So that's just, just the sleep is really bad, and then the gaining weight, and then my back pain. I'd say those are my main issues right now.
Besides taking medication, things like that, and of course coming here, how else have you been kind of coping with that?
I don't know if I've been coping appropriately, because like I said, I'd like to be outside and doing stuff, but I've been just kind of vegging on TV a lot more than I should be. I try to get to the gym when I can, but really I don't really want to go out and do anything right now, so I kind of stay home.
Okay, I'm gonna dig a little bit deeper into your family. So
Sure.
Can you just describe all the members of your family in the household that you grew up in?
My dad, he was a police officer. My mom was a computer tech. She did a lot of traveling with that. And then my brother is in the Navy. And that was just me.
Is your brother older or younger than you?
He's older.
By how many years?
3.
Around what age did he move out?
He enlisted at, he was like almost 18. Like they had a waiver for him because his birthday was later or something. But yeah, he was out right around 18.
Okay, so just right out of high school, when in the
Pretty
Navy.
much, yep.
Okay. Okay, so you said your support system is definitely your parents and your brother. Would you describe your relationship with them as good?
Yeah.
Definitely.
Mm-hmm.
So, in your family, in your immediate family, is there any history of medical conditions or medical issues?
I'm not positive because nobody really was diagnosed, but I feel like my mom had a little bit of depression, maybe a little bit of anxiety. And then I know my dad had some anxiety as well, just because of his job. But I don't know if these were diagnosed or not. But that's just kind of what I observed. I'm pretty sure my mom had depression, but she just didn't tell us.
What kind of traits did you observe in your mom that made you think that or made you feel as if she had depression?
Sometimes she would just, come home from a trip and we wouldn't really see her for like a day because she was just like wanted to be by herself. She just had like I don't know, like a sad kind of affect, like just kind of like moping around. And it would take her a while to get out of that, I think. She would still be pleasant enough with us, but I just felt like she was sad. Just noticing that when I was young and didn't know what to call it, but she just seemed sad.
Okay. What about your brother? Any medical concerns with him at all?
Not that I can remember. No, maybe just, being in the Navy, he probably went through some stuff, but nothing clinical that I can think of.
Okay. Then what about any substance abuse problems within your family?
No.
No? Okay. Any sort of legal involvement, legal issues, criminal history, nothing in the family?
No.
Good. And then anybody in the family at all have any sort of suicidal or homicidal behavior?
No, not that I know of.
Okay. Okay. Digging back into your childhood again, how would you describe your overall health when you were a child?
It was pretty good. I was healthy and a lot of sports and everything.
Okay. Sports were a hobby for you?
Yeah, one thing I really enjoyed.
What other hobbies did you have?
I liked studying languages. I'm not very good at it, speaking them, but I think they're interesting. It's interesting to just learn the origins of language.
Those are the only two?
Yeah, I wasn't really good at anything like art or whatever, or drawing. So really I did a lot of sports, so that took up a lot of my time. I did basketball and softball and gymnastics and swimming, and so, it just, there wasn't enough time for anything else. Maybe I did reading or something. That's it.
Okay. So I'm gonna ask a little bit about your educational background. So, let's see. What's kind of your school history like? Did you go to one school your entire life or one school district?
Yes, I was lucky with that.
Okay. How'd you do in school, academically wise?
I was good. I was B average, I'd say.
No kind of challenges with anything, any subjects, nothing like that?
I've never been strong at math, but I still got through with a B, so I was fine.
That's good.
Mm-hmm.
And then would you say academically, do you have any special abilities, talents besides sports?
I wouldn't say anything specifically. I was always pretty good at English. I'm very good at editing papers. People would always give me their essays, and I would edit them for them. I always really enjoyed that. Otherwise, I think that's about it.
Okay, that's good. So, you did graduate high school, of course, right?
Mhm.
What's your highest level of education?
I got a master's while I was in the service.
What's your master's in?
It's in English, actually.
That's good.
Mm-hmm.
Okay. So throughout all of school, including high school, college, anything like that, did you ever have any issues with conduct at all?
No.
What about bullying? Were you ever bullied?
No.
Okay. So I'm going to go into some of your medical history, and then of course current functioning, and then some nutritional information too. So of course your back pain is probably the main reason or is the main reason why you came in today, because it's affecting all aspects of your life according to you.
Yes.
Yeah.
Mm-hmm.
Okay, so what part of your back? Is it lower back, upper back?
It's my lower back by my hip.
You said on average it's a 6 out of 10?
Mm-hmm.
And currently you're just in physical therapy and taking some medication for it?
Correct.
Okay. How would you describe, besides that, your general health?
I'd say I'm pretty healthy. I mean, obviously, except for the gaining weight part, I still, for the most part, eat healthy foods and conscious of, what goes in my body. But I think I've just been indulging a little bit more lately and then having less activity, which is why I think I gained the weight.
Do you have any disabilities at all? What about any allergies?
Just seasonal allergies.
Do you take any medication for those seasonal allergies?
Just as needed, I'll take like a Claritin.
Okay. Besides your back injury, do you have any other history of injuries, maybe accidents or TBIs, anything like that? Like possibly from sports too?
No, I know that when I was younger, since I did gymnastics and softball, my shoulder was sensitive, like it'll crack still. But it wasn't an actual injury or anything. I didn't break anything. So otherwise, I was pretty safe. I was pretty lucky.
Okay. So this one's kind of going back to the weight gain. So you said you gained about 25 pounds, and what kind of time frame was that weight gained?
It was in the last 3 months. I had to buy new jeans because nothing would fit anymore.
And then you said you do eat healthy, but you described it as overindulge.
Yeah, I think I've just been, instead of having like a cheat meal a week or something, it's been like a cheat meal a day. I'll be like, oh, I can have that brownie because it makes me feel better. Like it just, the chocolate or whatever it is, it just, since I'm not feeling well, it just makes me feel okay. It just makes me feel a lot better.
Okay.
So I think I've been doing that more frequently than I used to. I used to have more discipline with all that.
Do you think that you would call that overindulging or do you think you would describe it as maybe a coping mechanism?
Yeah, I think so. Because I do notice my emotions are pretty like low when I go and do that. And I think, oh, you know what would make me feel better right now? Some ice cream. So now that you say that, it makes sense that I'm doing that.
Like we talked about your sleep patterns, you're getting around 5 hours of sleep now, waking up around 2 times.
Yeah, exactly.
And then have you ever had any diagnosed sleep disorder at all?
No.
Any history of dental problems or issues like that?
No.
These questions, or this next set of questions, are going to be a bit more personal, but of course it's all important about for gathering kind of your assessment. So we're going to go into sexual health and history.
Okay.
So how do you describe your sexual orientation?
Straight.
Okay, have you identified like that your entire life?
Yeah.
Are you currently sexually active?
Yeah, when I can be, when I have the time to go on dates. The last, like 3 or 4 months though, not as much really, I just don't feel motivated to go out and date, but I'd say with, before then I was average, I guess, I don't know what average is.
Okay, so like maybe within a month time frame?
Yeah, I'd say so.
A few times? How many?
Just like I've had just, one, maybe 2 partners within the last year. So, on average, once a week maybe.
Okay. And what do you do to protect yourself from sexually transmitted diseases?
Well, I only have 1 partner at a time, so that helps. And then, condoms.
Do you have any concerns about your sexual health at all?
No.
Can I ask a little bit or a couple questions about your substance use? I mean, you kind of said you don't really use that many, but just
Right.
want to get some more information on that. So,
Sure.
right now you said you have about 1 to 2 beers a week.
Yeah, it's beer or like a glass of wine. Usually just like on a Friday or Saturday, just to wind down. I'm not really much of a drinker, never have been. If that helps, yeah.
Throughout your entire life, have you ever used any other substances besides alcohol?
When I was younger, I tried pot, but that was like 30 years ago, I feel, at this point, 25 years ago. So, otherwise, that's about it.
Okay, nothing else besides that at all?
No.
So, do you have any history of substance abuse or substance misuse, treatment or care? Excuse me.
No.
Okay. Gonna move on to some questions about your military service and history of it. So,
Okay.
how long have you been in?
Oh, man, it's been about 17 years.
And it's been in the Air Force, right?
Yes.
And what's your MOS in the Air Force?
I'm Intel. It's 14N.
How many times have you PCS'd?
At least 6, I believe.
Did you ever have a break in service, any discharges, anything like that?
No.
Okay. How many deployments have you had?
3.
And where were those deployments to?
I was in Niger, and then Qatar twice.
What year were you in, what years were you in Niger?
It was 2015. It was a 6-month deployment. And then Qatar, I was there 2018, and then again in 2023.
And how long were those 2 deployments?
Those were both 6 months as well.
Okay. Do you have any upcoming deployments that you know of?
I hope not.
Were you ever exposed to combat at all?
Yes, in Niger. I'm not like one on the front lines since I'm Intel, but you know, we had a couple incidents with mortars and whatnot, and the local uprising kind of thing, or local, I don't know what you call it, their militias, but otherwise, Qatar was pretty safe for the most part, and no issues there.
The combat exposure doesn't cause any issues in your life at all?
Not that I know of. You know, the nightmares I'm having aren't about that. So.
Throughout all your deployments, is the back injury the only injury you've sustained?
Yes. Luckily.
Okay, so what would you say your overall impression or attitude about your entire time in service is?
Overall, it's been pretty fulfilling. I think at this point, I'm tired. You know, 'cause I'm hurting. So. Yeah.
I'm going to go into your employment and finance history. Of course, the past 17 years you've been in the Air Force. What about before that? Any other jobs, anything like that?
I mean, just kind of minor ones. I was a barista before I went into the military when I was in college. So I did my undergrad before coming to the military. And I was a softball coach. And that was about it. Cause I was just doing ROTC in the military, or in college to get into the military.
So right now you said that you're kind of wanting to retire. Does that cause any concerns for you, like financially, worried about?
The only thing I'm worried about is getting med board because of my back. Otherwise, I've got 3 years left till 20, and I feel comfortable with knowing I have a pension. So otherwise, yeah, unless I get medically discharged, which I guess I'd still be okay.
Okay. Have you ever had any financial difficulties throughout your life? Debt problems, credit difficulties, anything like that?
No, I've been pretty good. My parents are supportive as well. If I ever needed anything, and my brother as well.
That's good. I'm going to ask some questions about religion or spirituality, things like that. So, do you identify as religious, spiritual at all?
No, I grew up in a secular household.
Okay. Your entire family's kind of secular, no involvement in any form of church or nothing like that?
Nope.
Do you have any support from any religious community in your life?
I haven't needed it, no.
So there's some leisure and recreation questions, but we kind of already covered, you like to be outside, you like to hike, things like that, but it's been kind of tough since your back injury.
Exactly, yes.
Okay, yeah. Okay. So I'm going to ask any current legal concerns or any legal history in the past. So do you have any involvement, like on or off post with the military or civilian legal forces or whatever, let's say about your marriage in the past or any of that, any legal involvement?
No issues, no. Had a decent relationship, but like I said, we just grew apart, so no domestic issues there, and no other legal involvement.
So nothing to do, like, let's say, well, no charges whatsoever, like even for whatever reasons, driving, speeding tickets, anything like that?
I mean, when I was in college, I had a speeding ticket, but you know how campus police can be. But otherwise, I'm a pretty safe driver, and no real issues. No.
Okay, nothing on your record whatsoever?
Just the ticket.
Yeah, good.
I've gotten pulled over before, but it's been warnings.
Of course. Just a few more questions and we're almost done.
Okay.
So I'm going to ask about your culture per se. So how do you define or describe your culture?
I don't really know how to answer that. My family is from Italy and Poland, and so I've had a mix of upbringing with those types of cultural traditions, but overall I would identify myself just as an American at that point, being third generation.
Okay. What cultural beliefs, traditions, or values are important to you?
Just doing the right thing, treating others as you'd want to be treated. Just kindness and compassion. And we're big on social justice. So, like my dad was a police officer. And, so those are the big ones, I'd say.
Good. So, last bit, just going to ask about your strengths, capacities, resources, things like that. So, right now you say cope with like reading and things like that.
Yeah, I've been watching TV a lot, or like shows, Hulu and Netflix, and then I try to read I just kind of get bored with that sometimes.
What do you see as your strengths as a person?
This kind of goes with my culture, but I believe in justice, and so I like to stick up for people and my friends and do what's right. Used to be very active, like exercise and hiking wise, so that was a strength of mine. I'd like to get back to that. That's really how I would identify myself in that sense, being an active person. Yeah.
Okay. So you said of course, the back pain's limited you from partaking in these, in the active restraints. What other barriers do you have, like, as far as that? Like, is it hindering your ability to work at all, anything like that?
I've had to use a standing desk more because it hurts less when I'm standing than sitting. I am on profile, so I'm not able to do the full fitness test. So those are hindering factors for sure.
Okay, so moving on for future sessions, do you have anything that you think would hinder you from coming in?
No, my leadership's very good at letting people do their thing for medical and for their life. So.
And what's the outcome that you want from our meetings from moving forward?
I want to learn how to sleep better, and I need to lose this weight. So just kind of getting out of whatever funk I'm in is my main goal.
Okay. Is there any other resources that we can offer you?
Not that I know of.
Okay, that's about all the questions that I have. Do you have any questions?
No, I guess I'll see you next week at 2 o'clock.
Okay.
All right, thank you.
Perfect. Thank you so much.
Bye.
Bye.
Thank you.